We then examine each of the small joints in the hand, squeezing across the joint and moving the joint to see if there's any evidence of any localized tenderness or any swelling around the joints. This is done for both the wrist joints and also for the proximal and distal joints in the hands. We examine wrist movement passively, as well as looking for any tenderness over the dorsum of the wrists. A two-finger technique is used for examining small joints in the hands, squeezing across the joint while moving them. It's important not to forget the carpometacarpal joint and the first metacarpophalangeal joint in the thumb, given that this thumb moves differently to the rest of the fingers in the hands. We then turn the hands over and we examine for any flexor tendon abnormalities by flexing the finger while feeling along the line of the flexor tendon sheath. One's feeling for any crepitus in the flexor tendon sheath and also any nodules and any evidence of triggering of the finger. While the hands are in this position, we examine for carpal tunnel syndrome, which is an entrapment of the median nerve at the level of the wrist. Remember that this nerve is both motor and sensory, so we need to check for sensory loss in the hand and also motor involvement of all muscles of the thumb with the exception of the adductor of the thumb.